Check. One, two.
All right, hi guys. Welcome back to Dr. Gilead Show. Today is Thursday, um, December 1st. December 1st, 2016. Can you believe it's already? Oh my God.
End of the
The
year.
year is already ending. Well, welcome to Dr. Gilead Show today, December 1st, 2016. Today I have a special guest and we know her already. She's part of this already. Dr. Coakley. Dr. Coakley, tell us a little bit about yourself again for those who did not see you the last time.
Well, thank you again, Dr.
Swallow.
Aswala, for inviting me back. My name is Dr. Ilsa Coakley. I'm a clinical psychologist, and I practice in the Lanham Bowie area in Maryland.
All right. Thank you for coming this time again. As we do usually, we like to do a little disclaimer. Please, we advise that you don't use anything you hear on this program to make a diagnosis of yourself or treat yourself or diagnose a family member. Dr. Gilead Show, the producers, the host, cannot be held responsible for what anyone does based on what they hear on this program. We are on Facebook Live and WBGR Radio. You can reach us, you can call on 301-429-9247, 301-429-9247 if you have any question or you want to make any contribution. Today we are talking about adult attention deficit disorder or attention deficit hyperactivity disorder, adult ADHD. On this program, on this platform, we have talked about ADHD in children, childhood attention deficit disorder. We talked about that. But today we are focusing on adults. And I mean, it's unbelievable the number of adults that have this diagnosis. As we, like we said the last time, attention deficit disorder is defined as persistent pattern of inattention and or hyperactivity, impulsivity that interferes with the function and development of an individual. Is been seen more frequently in adults compared to before. We used to talk about ADHD mostly in children, but now we have a lot of adults coming in with ADHD symptoms. So it's probably they never knew what they had, and so when they heard about it, they looked at symptoms or the symptom profile. They said, "Whoa, I think I might have this," and they come for help. So it has to be. There has to be at least. It has to happen in two settings. It could be work, school, home, or social gathering, and it must interfere with the social or work in the work or social setting or in school if it's an adult. Dr. Coakley, in your practice, how much of adults do you see that have these kind of symptoms, that have ADHD symptoms?
As you said, it is a condition that I do frequently see presenting among adults that I work with, and many times it's not been diagnosed as when they were children. However, the point is that the symptoms were probably there when they were children,
Right.
and in order to meet the diagnosis, we'll talk about later, the symptoms would have had to be present even in childhood. But it's a very, very prevalent disorder that I'm seeing as well.
Right. So, and I think to make that diagnosis, it has to have started before the age of 12.
Absolutely.
Yes.
Yes, that's
so,
correct.
so there are three major presentations. The inattentive type, and that is difficulty focusing. We're going to talk about the details of the symptoms. Then the hyperactivity, impulsive type, and a combination of both. I was looking at the prevalence. It said that it occurs in any population. You have about 2.5% of the population having ADHD. That's big. And in the U.S., about 10.5 million people have ADHD symptoms. 10.5 million. That's not a little number. That shows a lot of people. College students, recently I've seen an upsurge in the number of college students that come with attention deficit disorder. And it's also said to be more frequent in males than in females, adults, about 1.6% to 1.6 to 1 male-female ratio. So it's not an uncommon illness. Anything you want to talk about with regards to male-female from what you see?
I do know that in terms of when it does present, even among children, we do see the prevalence being more so in males than in females, and I do think that that does explain why. I agree with you that we see more adult males presenting with those symptoms than females, but females do also have the symptoms. But in terms of how, the type, like you mentioned, there are different types that we may see, maybe the females having a different type, inattentive type more so, and the males may have either combined or hyperactive. So it may be more difficult to identify and label it as what some people assume would be hyperactivity, because they think that it has to always mean in terms of the hyperactivity symptoms have to be present. Sometimes we have inattentive symptoms, and we'll talk about that more in terms of the different types.
Right. Maybe because men are driven by testosterone, so we are hyperactive generally.
Right.
So we present more with that. But we'll take a look at those. Now, there are no real known causes of attention deficit disorder, but a lot of speculations on what could be the cause. Things that happen prenatally when the child is still unborn, and some kids, of course, there's some genetic component that is also involved because of twin studies. There have been studies where the whole family, the mother or the father, 2 or 3 children all have it, and so you're looking at, there must be something. It's not what they ate. It has to be some genetic thing that they transfer from one another. And there was this monozygotic twin studies that show that if one twin had it, the other one has a 40 to 60% chance of also having the same symptoms. So it's a common thing, and sometimes because the central nervous system, the brain, is very complicated. Any childhood infection or infections in utero, that's when the child is still in the womb, could affect the brain during time of development, and it could present with any of these symptoms. And sometimes we have children, they fall off the bed, they hit their head. So at the end of the day, we don't know what is causing what, but they could present with any of these symptoms of ADHD. So I mean, like people you see, any of them, anything you found or you noticed based on family or trauma or head injury, any of those things?
I think that normally we do hear another family member, either, especially a parent, maybe saying, oh, once they brought their child in for even an evaluation to rule out attention deficit, they then hear what the symptoms are of attention deficit, and then themselves recognize that they also have those symptoms. And so yes, I do see that there appears to be a genetic component because of the number of people who are related biologically tend to have the symptoms. And so as far as neurological symptoms, I think that there might be a secondary condition going on that might explain what's going on with any kind of brain injury.
Yeah.
But in terms of pure attention deficit, if someone, for example, has a head injury and is presenting with some of these symptoms, we may not call it pure attention deficit. So I think we want to help persons to understand that they'll be listening to what the symptoms are of pure attention deficit disorder. And then if there's another type of explanation, that's when you probably do need to have someone like an expert come in and help you understand how do you identify what this condition is. Is this purely attention deficit? is this another condition that's coexisting? Because that sometimes happens. And then we'll talk about some of the risky behaviors some of the persons with this condition may engage in that may lead to some of the head injuries. And so you might see head injuries, but because of the symptoms of the conditions that we're talking about. And we just want to help you understand how we collect all that information to help make a distinction between, is this still primarily an attention deficit disorder, or is this a separate neurological condition? Yeah.
So there's a question, a caller called, and he's asking, he says, why are more adults being diagnosed with ADHD in recent times? So there's an upsurge in diagnosis or presentation, or people coming up to providers asking for evaluation for ADHD. So the question the caller is asking is why? How come there's such an increase in the number of people being diagnosed with attention deficit disorder or attention deficit hyperactivity disorder? So that's the question. What is going on here? What could be
I can give you some thoughts I have.
Yes. What are your
I
thoughts?
think first of all, just exposure. So as there are more persons like ourselves, mental health professionals, educating the public about the signs and symptoms, then we would then hear persons maybe present themselves to a professional, a healthcare professional, and then the disorder becomes confirmed. So I think just exposure, first of all, knowing that this is not just, again, what we're eating, thinking it's because of too much sugar, and that's explaining why a child is being hyperactive. In terms of just knowledge, that's the first thing. Access also to health care.
Yep.
As we then create more access to health care for more people, then we have more people who probably needed to always have these conditions diagnosed and treated, now are for the first time doing so. And so those are some of the factors, I believe.
Right, and I've had people, I had a teacher, so she went through middle school, high school, struggled, but parents never wanted her to get any treatment. They knew something wasn't right, so she struggled all through, went to college, graduated, but it was a huge struggle. She started teaching as a substitute teacher. Then she saw her students were doing very hyperactive, running all over the place. By the middle of that semester, they calmed down, and she was asking the real teacher, what happened? Oh, they have ADHD, and they started back on their medications. That's how she knew. She said, well, I struggled with this all my life. And someone referred her to us. She came, we put down very small dose of medication, and she did very well. She went back to college, as a matter of fact, and she did very well. So I think it's the information is out there, the knowledge is out, people are knowing more about it, and so we're getting more people coming out openly to say, I have this problem. And also culturally, people don't want to come out and say, I have this problem, because it makes them feel like they are not strong. So.
Yes, you made a comment earlier about the prevalence of attention deficit disorder among adults, and then you mentioned worldwide, I think, or you mentioned something about it's not just limited to the United States.
No.
The prevalence that Dr.
2.5% worldwide, right, in any society.
In any society, and I think that's the point, that depending on where you're living, you may not have the same access. You may not think that this condition exists in your culture, but the truth is, it does exist.
Yeah.
And the prevalence is worldwide, based on wherever you happen to live. 2.5% of the population of your country would present with this particular condition. But maybe culturally it's not accepted as being a real condition. And some people, for the first time when they migrate elsewhere, they are living in another society that recognizes it and accepts it as being a real condition, and then the real treatment can begin.
Yep. Yeah. And in some cultures, when you're hyperactive, you're doing all this, they yell at you. If you're young, they get you whooped, whoop you so bad, but yet it can't help you because you're struggling. Is because of the way your brain is wired. It's a struggle to stay focused or to stay calm. But whooping doesn't stop it. Yelling doesn't stop it. So the adult is struggling, making all kinds of mistakes. So people are really coming out openly now to say, hey, I think this is what I have. And once you evaluate them, you get the right diagnosis, and people get well. and it spreads. It's word of mouth thing. People talk about it, and it's just somebody who used to be hyperactive and making all these mistakes, and the next time they're calm, they're doing so well. What happened? What's going on with you? Oh man, I got diagnosed with ADHD and I'm taking medication. It spreads that, whoa, okay, this is what he really had. So that is one of the reasons why it's becoming more common. But also, the other thing which I'm always suspicious about is there are people who are coming to seek medication. But we're going to talk about that when we get to the treatment of attention deficit disorder. We're going to talk about the medications that are used, and you could see why sometimes people will want to come claiming that they have ADHD so they can get the medications. But we'll talk about that later. All right, so let's look at the presentation. How does ADHD present? Dr. Coakley, there are different presentations, the inattentive type. From your practice, what do you really see? What kind of what are the things you see that you say this person has attention deficit disorder, inattentive type? What are the symptoms that they could present with?
Well, when you hear when we say inattentive type, the term gives us a clue as to what symptoms we are expecting to see. Inattention. So perhaps that person might be not focusing, maybe what they may call daydreaming, or having a difficulty just staying engaged in conversations. If they're a student, just listening to information that's being shared by an instructor. If you are an adult, it might be the same with maybe on your job with coworkers or supervisors, just not able to listen, especially when it's not exciting. So if you're in a lecture, or if you're in a business meeting, then it's harder to stay focused. So again, it's all about making a lot of mistakes because you're not paying attention. Again, it takes focus to not make mistakes when it comes to writing and spelling, and or maybe depending on the type of work you're doing, it's about maybe paying attention to slight differences between information, and if you're not able to focus your attention, then you see more errors being made. So those are some of the symptoms.
So and some of them, because of the difficulty with paying attention, they avoid some things. They don't want to deal with some tasks because they know definitely they're going to make mistakes.
Or other things just don't get done.
Yeah,
things don't
exactly.
get, especially if they find them difficult to sustain their attention. If it's a task that requires a lot of time and a lot of concentration, then they avoid altogether the task, and then that's another task that never gets completed. So.
Yeah, and I had a patient who was talking. She loses her bunch of keys 25 times a day. So every minute she's asking, who saw my bunch of keys? Where are my bunch of keys? So the spouse is saying, okay, put the bunch of keys in one spot every time you come in. She does it today, the next time she doesn't know where she puts it. And the funny one was, this lady, every time she's looking for her bra. Who saw my bra? She can't find her bra all the time. And so this, because of severe inattention, is one of the major symptoms. They get easily distracted. They are somewhere, a sound goes off somewhere, they're facing that. They can't stay on task. They can't stay focused on what they're doing. And of course, because they lose attention, the chores at home, at the place of work, and you have all these people fighting at home because the chores that they're supposed to do, they don't do it. So the inattention is a major symptom, and it brings a lot of conflict in the homes or at work, or even among friends and families. Yeah. So the other one is the hyperactivity, the symptoms of hyperactivity and impulsivity. You have people that are always, they fidget so much. They can't stay still. They're tapping their feet. I had this guy. Every time he just cannot keep his hands to himself. He comes to my office, he's touching this, he's moving around, he's rolling on the chair. I said, man, what's going on? He said, no, I haven't taken my medicine. So they are very hyperactive, they fidget, they tap their hands on their feet, they scream on the seat. And even at the place of work, in meetings, they can't sit more than 5 minutes. They're up, they're going. Every time you see them, it's like something is pushing them to go. It's a very difficult situation for a lot of them. They can't help themselves. And the one of the ones somebody was talking about is they talk excessively, and they interrupt other people. You have a meeting, you're talking, before you finish saying what you're saying, they're jumping in. And most of the times, what they're saying is the wrong thing. So they have a lot of conflict with other people in meetings, at the place of work, as the case may be. So these are any other symptoms of hyperactivity?
Yes, I think that because we're talking about adults, sometimes you may notice if an adult is driving, they tend to have engage in risky driving behavior. So they tend to speed a lot. Again, think about it. They're not likely to want to sit still. They don't like to sit at the stoplight. It gets them frustrated having to wait a few minutes. And so some people don't sit at the stoplight, and so they'll have more speeding tickets, more traffic citations. And that's actually something that might not be a symptom that is listed in our official diagnostic criteria, but clinically speaking, that's one of the symptoms we tend to inquire about, and it helps to distinguish like the adult presentation of attention deficit disorder. So you mentioned in terms of excessive speaking, if they're among other people and maybe not saying the right thing. So in terms of being having outbursts and being a little bit aggressive in how they speak, and even beyond speaking, sometimes becoming more physical at times. But again, it's all about having difficulty controlling impulses. And so we do have persons engaging in maybe physical altercations or more just verbal arguments. And so you may learn to ask about, have they been involved in any kind of altercation? Has the police ever been called? And you frequently find that the answer would be yes. And again, this is a legitimate issue with persons with attention deficit disorder, because I don't know if we mentioned earlier that structurally their brain is the frontal lobe of their brain actually is different than that of other people who don't have this condition. And so the frontal lobe of the brain really it controls what we call executive functioning. Right. And so the planning, the organizing, the controlling impulses, that is what that area of the brain controls. And it's impaired. It looks, if you were to take brain scans, it looks very different among persons with attention deficit. So all the behaviors that we're talking about, the risky driving, the outbursts, the difficulty getting to work on time or getting to meetings on time, or trying to juggle too many tasks, depending on what they're doing for a living, if that's a part of in terms of multitasking, then they tend to struggle. Another thing I wanted to mention would be staying organized.
Very disorganized.
Very disorganized, and so depending on what their work involves, then being able to find the items they need may be difficult to find. Like you said some people it's the keys. For other people it could be the items that they need to engage in their job. So if they need tools, they may not be able to find the tools. If they need if they have paperwork, then they may not know that it's disorganized, or they may know it's disorganized and not know how to compile the information in a more organized way. So organizational skills is one executive functioning task, and that is impaired. So
talking about frontal lobe, because the frontal lobe is where it really inhibits you, calms you down. When the frontal lobe is impaired, you blurt out answers, you can't wait, you just say things without thinking about it. Absolutely. That is one of the real symptoms of hyperactivity, symptoms of ADHD. But we're going to take a break, but I want to really recognize Oh yeah, Soga Chukuma, thank you for tuning in. So Chenda, so many other people there. Yeah, thank you for tuning in, all of you. I think there's a question there. I have to take that question. It says, can people with this disorder still be organized after treatment of symptoms? So it says, that's the question. Can they get better organized if they are treated?
You know, I think as we talk about treatment later on, there are different types of treatment. Medication is one of them, but depending on the symptoms that they're presenting with, because everybody presents somewhat differently in terms of the range of symptoms, we're expecting a certain core group, but you may need more than medication to control all of the symptoms.
Right.
So you need to have perhaps a person that helps you learn how to organize. And so there are people who maybe you need to have a certain type of professional who helps you, whether it's an occupational therapist. Sometimes we have persons, you can start some of that work in your psychotherapy session, just understanding that there's more than the medication component of it. But medication controls a lot of the symptoms, but not all of them. So we would need to sort of educate persons. The treatment involves education as well. So we would have to educate persons as to the range of symptoms and why a combination of treatment would be best. And so it really does start with medication though, and then especially depending on the type, and it also depends on the symptoms that are presenting, as well as how impaired the person's life is. I'm not sure if we have to take a break at this moment.
Right, yeah. So we're going to take a break. You're tuned to Dr. Gilead Show. We're talking about adult ADHD, attention deficit disorder in adults. That's what we're taking today. And my guest is Dr. Coakley. She is already known on this show. But we'll take a break. Stay tuned. We are on WBGR Radio and Facebook Live. We'll be back shortly. Stay tuned.
Sounds
good. You have two questions, you said?
Yeah. All right. Mike Green said he had a discipline problem but turned out fine. Are there any wholesome herbal medicines?
Okay.
And then somebody said, does smoking weed help ease the tension?
Oh, you know what? That might be one that you may have to. Do you get that often? Yes.
Yeah.
I think I would like for us to definitely talk about that.
Yeah, of course it would be.
Because we get that all the time.
You're going to have to move your mic back.
Yeah, okay.
Yeah, but yeah, those are two questions.
Okay.
Are there wholesome herbal medicines from Michael Green, and does smoking weed help ease the tension? Might make you a little hungry, but
I don't know if we mentioned, we might have commented on this, how it makes it difficult to succeed in the workplace.
No, we're going to get that.
That's going to be great.
Effects on the guy.
Great.
So it says, does smoking weed help?
yeah, it'll help ease the tension.
I get that question all the time.
Yeah.
All the time, in terms of especially people with this condition.
Yeah, they tell me it
It's a
helps.
natural herb.
They say it helps, but they don't want to take anything else for it.
Yeah, exactly.
So,
All right, 10 seconds. 5, 4, 3, 2, 1.
All right, thank you. Welcome back to Dr. Gilead Show on WBGR Radio and on Facebook Live. Today I have Dr. Coakley as my special guest, and we are on, you can call on 301-429-9247, 301-429-9247. If you have any questions, if you have any contributions. I see Teresa Smith, I see Iloma. Thank you all for joining. Dr. Soga, thank you for joining. So, we had two questions during the break. Dr. Coakley, one of the questions says, are there wholesome herbal medications or medicines that could help with attention deficit disorder. What are your thoughts?
Well, you know, I know that you are the medication management expert here, and so I think that I have some thoughts, but I defer to you because of the medication management expert. Okay.
Well, you know, I get this question all the time. People come and, well, I'm going to take the two questions together. The other one says, does smoking marijuana, does smoking weed, does smoking pot help with attention? So, and I see people come to me and they say, well, weed is a natural herbal stuff. It's natural thing. It grows in the, it's a green leaf. It helps with attention and all that. When I smoke it, I feel calm. Okay. Now, with regards to approved treatment modality, there are no known therapeutic herbal treatments that I know about, but if there is any there, we're yet to find out. But with regards to marijuana, marijuana may calm people down, but their thoughts are still moving fast. They may sit there. At the end of the day, they have no interest, no zeal to do anything, but they are calm. That's not what you want. You want to stay calm and be productive, and for your brain to function properly, and not just smoke weed every day and time passes by. And family is going to ask you, what you doing? You say, I'm chilling. I'm chilling. No, you're not chilling. Your time is passing. So I think to the best of my knowledge, marijuana may calm you down, may make you feel calm, but you're not going to be productive. Your thoughts are still racing. You're still inattentive, even though physically you're sitting calm. You're kind of in a daze. So that's not the kind of help we need. People come to me and they say, oh, marijuana is approved. Now, can you prescribe me medical marijuana so I can focus? I said, no. Medical marijuana, if it's approved, is for specific purposes, not for attention deficit disorder or any of those. And the amazing thing is, some don't want the real medication that is approved for it. They just want medical marijuana. That's not what we do. So the answer to that question is, there's no known herbal one that I know about, and marijuana is not the help that you need. You need a medication that has been proven, tested to have a good effect for your attention. I mean,
absolutely. Well, I agree with what you're saying, and I wanted to add that it's a very frequent question that I also hear among the patients that come in for treatment, for diagnosis and treatment. They say that they are frequently using some sort of substance, and so marijuana, or cannabis is what we call it, the official term, tends to be some sort of substance that they're using. But substance abuse is frequently found among persons who have attention deficit disorder. Whether it's so I wanted to point out, it may not just be limited to marijuana, but I wanted to point out that we frequently hear alcohol abuse or another type of drugs, another type of illicit drug that is used. And the way that I hear that is that there's some awareness that something's not functioning quite right in that person's experience in their brain, and they're trying to self-medicate.
Yes.
Is what they're doing. And so again, because it's not something that's been scientifically proven to be helpful for attention deficit disorder, although they may subjectively feel as if it's helping, when we have objective measures, it's not supporting the idea that this is a helpful intervention. And I wanted to further add that Dr. Oswala mentioned maybe feeling, the person says, oh, well, I feel calmer. But one of the symptoms of attention deficit disorder is difficulty initiating things.
Yep.
So getting started and getting going, it's already a problem for most people. So if you were to add to that, using marijuana, you really are going to have a hard time getting anything accomplished, not even started, much less completed.
Yeah, and that happens all the time. You see people who probably were doing a little better, then they start smoking marijuana because they're looking for solutions for their hyperactivity or poor attention. they smoke marijuana, then they completely stay home. They don't go to work anymore. They just sit home, smoke marijuana all day. I asked somebody, man, I say, once I get a hit of 2 J's, I'm good. I get 2 J's, I'm good for the day. Well, but you don't achieve anything. That is the main problem. So marijuana is not the answer. I think the best answer is to go get evaluated and get the right treatment, and you feel better. All right, thank you for those questions. Dr. Coakley, when people have ADHD, adults, what are the effects of this on the individual? How when they come to you, what are the things they complain about? What are the difficulties they have with regards to, I mean, their life generally, work, home, marriage? What are the things you've seen?
Well, in terms of, we talked about a little bit about staying organized, and so that sometimes is a problem. So we're talking about getting things accomplished at home and at work would tend to become impaired. So sometimes they're not able to get their paperwork completed if they have administrative tasks at work. And that could really be a problem, because for some people it could lead to them being terminated.
Yep.
So their careers frequently are impacted. And even if they don't have administrative tasks, again, getting to work is a problem for some people, getting to work on time. So we're expecting to hear some kind of interference with their functioning at work, or if they're adults, is what we're listening for, either not being able to hold a job or not being able to keep a job, because some people frequently change jobs because of what we're mentioning, not being able to perform very well, and then not being able to advance in that career because, again, they're not able to perform very well. So they would stay at a lower level of their job in terms of the overall cooperation. They're not able to advance. So, and then in terms of, you mentioned relationships, we find a lot of, we talked about outbursts, not being able to speak in terms of what to say, when to say it, when not to say certain things, not being able to control what they're saying, not using what we think is social etiquette, but the point is there's something going on structurally in their brain that's impairing that, but it affects relationships. So whether that's relationships with coworkers, relationships with your boss, relationships with your spouse, relationships with neighbors, you're going to see a lot of impairment there, and they are going to have a difficulty getting along with people.
Yeah.
So so I think we've covered. I'm not sure if I omitted anything.
Also, well, in the family, you've talked about that, but you see a lot of conflict. A lot of conflict in the family. I had a patient who. This is ironical. Now, before he got medicated for ADHD, the house was upside down. He didn't mind. But once he got medicated, he became more organized. Now the wife was having problem with it. The wife says, "You're too picky. You're not the man I married." So that became a problem. So, but prior to that, he was disorganized. The house was disorganized. Everybody was okay with it. But once he got better, then it became an issue. So when people have ADHD, they're so disorganized at home, they don't have the patience to listen to their spouse. I hear you women need to be listened to, right?
Yes.
You want us to just keep quiet and listen. But men don't have that patience. Then of course, if the man has ADHD, that's worse. So it brings a lot of conflict in the family. And of course, raising children, if they have children, is another major one. And like Dr. Coakley said, at the place of job, they can't communicate with colleagues at the place of work. So there's always a lot of conflict. The other thing I found out is when people have ADHD, because of their general behavior, people don't want to deal with them. They're generally rejected because you can't have a reasonable conversation sometimes, because before you finish saying what you're saying, they're jumping in, talking over you. So people stay away from them. People tease them, and they feel bad. They isolate. They feel disrespected a lot. I have some, a friend of mine. Anytime he's in a meeting, even before the question or before the other person finishes what he's saying, he's already jumping in, talking about something else. And people say, "Hey man, calm down." So, but that is him. He wants to do it. He calms down. The next 5 minutes, he's doing exactly the same thing. So they have a lot of social issues with other people. The other thing is relationship, poor relationship. Because of their hyperactivity, inattention, it's hard to keep relationship. With even dating becomes a problem because they can't get there on time. Imagine you have a date and you're waiting all day because they can't organize their life. They can't get out from their house on time, so it affects the general life of the person. But for families, how does this affect the family as a whole, the family unit?
Well, as you mentioned, if a person isn't able to hold a job, or if they get terminated often, then it affects anyone that they live with. And if they have a spouse, if they have children, then their economic security is jeopardized. So imagine again, if your parent doesn't have a job, then it affects the child. Do they have their basic needs met? Do they have their electricity on? Because chances are they'll forget. If the spouse with attention deficit disorder is responsible for paying a utility bill on time, they may have difficulty remembering that. And so there's some practical evidence there in terms of bills are not paid. You end up either be at risk of being evicted, or at risk of losing any basic utilities, or just living in a very chaotic environment where you can't always predict, is this person going to pick me up from school, because they tend to forget or they tend to run late. So it really could then affect everybody who's associated with that person in terms of social life, in terms of economic stability. But also, you mentioned something that I'm not sure if we're going to get back to. If this person is having trouble socially, and they present as, they probably will be losing lots of relationships, losing lots of jobs, feeling not so good about themselves, they're not advancing on the job. Frequently, they end up having a mood component, like a depressive episode. That's another frequent, attention deficit doesn't always present in isolation. You will hear other related conditions, I'm not sure if that's coming next, that we tend to sometimes see that presents with persons. So, but my point was, mood disorders like a depressive episode may occur because of these losses.
Right. So that is definite. I mean, I had a patient an adult. I think he was 23, but he came with his mother. You can see mother herself has ADD or ADHD, and the guy was talking about as a child how they moved like every year. They hardly were in any apartment for one whole year. There was always disruption because the mother would lose the job, get another job, and they would move. Then they went homeless just because of simple, poorly treated attention deficit disorder on the part of the mother. And these are the things we see, how socially it affects the family.
Yes.
And this boy himself, of course, genetically inherited it from the mother. He has ADHD, but because mother had gone through so much, she brought him in early, and he got the help he needed. So, yeah.
I wanted to also talk about the social impacts. Suppose if a person, again, has untreated symptoms and they are presenting as hyperactive and impulsive, and then they're driving, and think about the danger it presents to other people on the road. So in terms of more car crashes, if they're using substances, as I mentioned before, that tends to also present if they're using substances, trying to self-medicate with unapproved substances, then again contributing to the dangers of people in society when they're driving or using any kinds of substance that they shouldn't. So just danger, or just interacting, again, being very argumentative, being prone to being very physical. Those again that would pose a threat to persons, and they don't always have to know them. There's a lot of road rage, and I find is some of my clients will talk about how difficult it is to not demonstrate that road rage. Sometimes they do until we get the symptoms better managed, helping them to understand and evaluate their options in terms of how they can try to act. Once we have the medication as a part of the treatment, then helping them to change their behaviors as much as they can. as well. But there is a lot of impact on society.
A lot in the
in
society, yeah. Even money lost, time lost from work. Generally, a lot of conflict in the society. It makes their, because their life is chaotic. Anywhere they go, they bring chaos there.
Absolutely.
Yeah, so it affects the whole society in general. Now, what are the treatment options there? The major treatment options are medication and also psychotherapy. With regards to the medications, we have mostly stimulants. And that's why I was talking about, initially when I was talking about a lot of college students coming in to get treatment for ADHD. So you don't know if really do they have the illness, or they just want to feel high a little bit with the medications. Because most of the medications that are used to treat ADHD are stimulants. So these are medications like Adderall, Vyvanse, Concerta, Ritalin. The good old Ritalin is still there, but there are people who are genetically predisposed to becoming addicted to anything. So once you do a little stimulant, that's it, they're gone. They run around, they're looking for it, they jump from doctor to doctor shopping, looking for these medications. Because of this, these medications are highly controlled.
Yes.
And but they work. They really help people. If you find a good prescriber, a good doctor who knows what he's doing, give you the right diagnosis, prescribe the right medication, and build up the dose. Because these medications have bad side effects. They can cause headaches, decrease in appetite, chest pain, abdominal pain. The extreme side effect of most of the stimulants is heart attack. So the heart can stop. And so that's why for anyone that comes to me, before we prescribe any of the medications, we first of all make sure you don't have any cardiac problems. Make sure that mentally you're doing okay. If they have any co-occurring illnesses, those are all taken care of. But once you have a history of substance abuse, then it becomes a problem. Yeah. So the medications are mostly stimulants. There are some that are not, like we could use, like Wellbutrin or Strattera. Those are, but people, I think people get more help from the stimulants. And the danger in that is the addictive part of using those medications. So we are always very, very careful when we do those. With regards to herbal stuff, like we talked about, we don't know yet. But the other types of treatment modalities we have, Dr. Coakley, what do you do normally when they come to you?
Well, first of all, as we mentioned, we know that this person does not normally live in isolation, so we have to listen for all the people who are affected. So sometimes we try to remember that there are relationships involved. So frequently, just allowing persons to come in and bring in anyone in their life that maybe their relationships are already impaired. So sometimes I frequently see parents and adult children come in together, and their relationship has been strained for a long time, and working through some of that, just understanding first of all what's going on. And again, sometimes it was never diagnosed in childhood, and so education is where we usually begin, and trying to educate the relatives in terms of, is this a real condition, and then so that they will then no longer maybe interpret it in a very negative way, assuming that these were all intentional behaviors. And so it really does start with educating the persons involved in their lives, first of all. And then we try to help repair some of the relationships that have been damaged. And that really involves a lot of communication, a lot of just allowing someone to bring some calmness into the room. And that would be through a third party like myself to help communication occur, to either revisit issues, misunderstandings. Again, sometimes we have to get the individual in a place, whether it's through learning how to reevaluate their own thinking, So we use the cognitive behavioral approach frequently. We're trying to help them again understand their thoughts and maybe challenge, well, I made these assumptions in my thinking, and help them to examine, well, are those thoughts always accurate? So then the behavioral component frequently is changing their actions. So we have to identify what the behaviors are that have been problematic. And then sometimes we try to set goals that are behaviorally measured to help people make some changes in their actions. So again, if a person forgets where their keys happens to be, the first thought would be try to teach them, okay, where would be a place that works for you that might allow you to better remember? And you know, we tailor that to the person, but we have to ask the question. Maybe nobody's even asked that very basic question before, and we give them a chance to think about that. Okay, training yourself to have a routine, for example, training yourself to get up earlier so that you have more time if you know that you tend to sort of get distracted. Training yourself to have stress management techniques. That's a really significant behavioral change, whether it's exercise. So we want persons to learn that they can change their behavior. We can have them think about, well, how can you organize yourself better? Are we talking about what tools, what do you have how do you carry your item into work? Sometimes they haven't even thought of that.
Right.
Oh, okay. So then we talk about, well, what does that article look like? What does that, in terms of whatever you're using to carry your items, tell me, what does it look like? So we actually ask very basic questions to get the thought patterns in terms of, well, this is what I'm doing, this is what's not working, but examining information, and then asking them to make a change. So setting a goal frequently, whatever that goal is, making one change, whether that's in their exercise routine, one step, you know, maybe starting a program, starting slow, but we're asking people to change their behavior. Frequently we talk about learning how to relax and manage their stress as we talk about exercise, because we want them to understand, again, mood disorders like anxiety, depression frequently present with these individuals. And so we want to help them realize that, well, if they were to incorporate these types of behavioral changes, like exercise, like relaxation exercises, for example, you know, we actually can help people learn to relax their individual muscle groups. And it's a strategy that helps people learn, oh, there is something I can do. There's also something we can teach them. Instead of reacting impulsively, we need to learn to stop, learn to not act right away, but learn to take a moment. Do you need to walk out of the environment for a minute and let people know I'll be right back, instead of acting right away? Do you need to take a moment and learn how to breathe? We teach people there's a certain style of breathing that's calming. And again, these are behavioral changes. We want to teach them, well, how do you know you're going to have an outburst before it happens? We break it down, because normally if they pay attention, we have to help them learn the early warning signs. So sometimes it's getting hot, sometimes so they feel warm in their bodies, sometimes they'll say they can feel their fists balling up, they're getting tense. So it's about asking the questions to get them to learn more about the behavioral component of their behavior, and then meaning like the behavioral symptoms and signs of their, so that they'll know how to identify the indicators early enough to make some changes later on. Also in terms of job coaching, sometimes we have to talk about, again, practical things on the job. Sometimes we need to have them consider, do they want to share with anyone on their job, like a supervisor? If they're in this country, they have laws that protect them. If they choose to disclose that they have an attention deficit disorder, that perhaps it could be an opportunity to get some protection, but also get some accommodations on their job, meaning more time to complete paperwork, more time, or even reducing their tasks to what is required, what is a minimum that's accepted. So what we actually can share with them what the law provides as some sort of protection, so that they will not necessarily lose their job if they choose to disclose, so then their supervisors understand them better.
Right, but one thing I've observed in there, I have some adults who are in school, but they're requesting for more time for some accommodation, and the school will refuse.
You know, well, I'm surprised. Well, normally, my experience is that we do get a lot of support from the school. However, they usually have to meet a certain standard of evidence. And so, as far as identifying if this truly attention deficit disorder, if you're dealing with a school environment, or if you even if you're talking about higher level education, professional schools, graduate schools, there's a very clear standard. So we need to have objective evidence, and fortunately, although it's not required always to meet the diagnosis to go and do any kind of additional psychological or neuropsychological testing, you can meet the diagnosis by, many people feel comfortable enough doing that by interview, but someone like myself, especially when we're trying to meet the standard required for education.
So what do you do?
Oh, we have instruments that are standardized instruments that are accepted in terms of evidence. We expect a certain profile on a range of tests that we give persons. They are individually administered tests. Sometimes we ask questions, sometimes when we're recording by hand the responses of the individual. Sometimes we have them complete a task and we're timing them. Sometimes, so it's a range of tests that we're doing, a range of subtests. And we know what to look for to support our the question, is this attention deficit disorder? There are certain tests that tend to be more difficult for persons to complete, and so if the profile is consistent with what we expect, then we would present the evidence explaining what the tool was that we're using, and I'm not calling it here intentionally, but we have certain tools that as clinical psychologists that and some school psychologists also are trained to administer, score, and interpret these instruments, but that's how we objectively measure attention
Will
deficit
the
disorder.
insurance company pay for that? Because that's another problem we all face.
Well, fortunately, my experience has been with the changing healthcare when it comes to mental health. It is being covered now, and it's being covered pretty much at the same level of the treatment for the intervention for mental health. And so it's good news that if you need to have neuropsychological or psychological testing done, sometimes people call it psychoeducational testing done, then that is available, and it is frequently covered. It depends on the person's individual plan, of course, but it's available. And so if we present that evidence to the school, then my experience has been that they do go forward and they do give extended time on tests. Sometimes we can ask for quiet environments where the person is tested individually. Sometimes we ask for noise reduction instruments that they can use, or like a headphone type that they can use if they are among other people. But breaks also, having breaks, if you're a student, more breaks than normal. If there are no breaks, then asking for breaks instead of seeing it as really being disrespectful or disruptive, then realizing that we find that sometimes that's helpful to break up something that maybe is a long meeting into a smaller chunks of time, even if it's a 5-minute break, water break, bathroom break, stretching the leg break. We find that that's helpful.
I think I need to stretch my legs now too.
Absolutely. We have been talking for a long time. Yes, those are some interventions.
So but we can really send people to you. You do those evaluations.
Yes.
That's wonderful
Absolutely.
to know. So I mean, if you're watching, you can tell your doctor to send you to Dr. Coakley. She will do the evaluations, and you get the right diagnosis. I see. Gloria. Oh, hey, Gloria. Yeah, Gloria. Thank you for tuning in. Benga, thank you for tuning in. Well, you are on Dr. Gilead Show, WBGR Radio. We've just been talking about attention deficit disorder in adults. Dr. Coakley, I want to really thank you for coming. Hey, this lady that is always looking for her bra, what should she do? What advice do you have for her?
If she has, again, where does she normally get dressed? Where does she instead of going and putting it in a different room, where does it make more sense? In terms of, I would ask her.
Keep her in her purse or something?
No, I probably ask her, again, to keep it close by, but have all your items together instead of having it scattered about. So it's about trial and error, though. It's about giving it a try, asking them if they tried it, because sometimes it takes them a while to try the suggestions. And then depending on what the feedback is, we try to make another change. It's all about making small behavioral changes.
Yes.
And that is a part of the treatment as well, and seeing if that change is effective. If it's not, then find another intervention to test.
Right. I mean, for me, once I have a particular place I put my keys, and once I get home, I hang them there. Everyone knows that's where the keys are kept. So I think if people could just learn to compartmentalize stuff, put them in the same place all the time, they may have better ways of managing their attention difficulties. Anything else you have to say? Last word on this?
Well, last word on is that they may need some help with doing some of these changes, especially organization. It's hard for them to know where to begin, especially if they're in a very chaotic environment. So we sometimes make recommendations, and they're by themselves listening to this. But I think having someone else around, hopefully, if they're fortunate enough and they have relatives, loved ones, to hear the feedback, hear the suggestion, and it's really, because again, unless they are, if they're even medicated, they may need to have, it's not going to be sufficient to control all the symptoms like being organized. They have to hear, okay, we need to learn how to take the receptacle bins or whatever we're using to help organize items, files. Someone has to actually take the initiative to go and help them acquire those things. Because if you tell them to go out there and do it, because initiating a task tends to be a challenge, they may never get the tools they need.
Right.
So they need to have help. Sometimes it comes through loved ones, and if not, then we have to try to find some hired help.
True, and one of the things I do sometimes is bring family members to come in and really talk about what they have. And I found that once family members, spouse, children, or parents understand what their family member has, they're more supportive, they're more understanding, and it reduces the chaos at home, the conflicts, and they have a better environment where they all live peacefully. All right, so well, thank you folks for tuning in today to Dr. Gilead Show, WBGR, and FaceTime, Facebook Live. You can always reach us. Well, Dr. Coakley, what is the best way to reach you before I forget that?
My phone contact is 301-399-9119.
Okay, so Dr. Coakley is a licensed psychologist. If you see your doctor, your psychiatrist, or your nurse practitioner, your prescriber, and you think you need some therapy, also some psychological evaluation, please ask, and you'll be referred, because I know she will give you the best. She will get the best out of the evaluation, and she'll give you the right diagnosis. Well, you know me, Dr. Theo Oswala, I'm a psychiatrist. We are at 9470 Annapolis Road, suite number 117, here in Lanham, Maryland. Phone number is 301-577-9111. 301-577-9111. Thank you very much for tuning in. We've talked about ADHD in adults, and we'll see you again next week, Thursday at 1 p.m. Dr. Coakley, thank you very much for coming.
Thank you for having me.
It's really a pleasure having you again.
Same here.
And we appreciate your coming. Thank you very much. Thank you, guys. We'll see you again next week. Thank you.